Navigating breast reconstruction. Options, procedures, and recovery of breast cancer diagnosis is a life-altering event, and the surgical requirements, such as a mastectomy, can profoundly impact a person's body image, sense of femininity, and self-esteem. To address these psychological and physical changes, many patients opt for breast reconstruction. While approximately half of women choose reconstructive procedures, others decide to go flat. It is important to note that reconstruction is not a one-time decision. It can be performed during the initial cancer surgery or even years later. Reconstruction after a lumpectomy reconstruction is not limited to mastectomy patients. For those undergoing a lumpectomy, a breast-conserving surgery where only the tumor and a small margin of tissue are removed, surgery may be needed to restore symmetry if the procedure leaves the breasts looking uneven. Common techniques. Oncoplastic reduction. Ideal for women with larger breasts, this procedure combines cancer removal with plastic surgery to lift, reduce, or reshape both breasts to ensure they look even. Fat grafting. Surgeons use liposuction to collect fat from areas like the abdomen, thighs, or buttocks, which is then injected into the area treated by the lumpectomy. This is often done a year or more after cancer treatment to allow the body to fully heal from radiation. Reconstruction after a mastectomy. When a mastectomy is performed, patients generally choose between two primary methods of rebuilding the breast mound: implants or autologous tissue. Flaps. Implant reconstruction. This is the most common method, utilizing saline or silicone implants. The process. While direct-to-implant surgery is possible, many surgeons prefer a two-stage approach. First, a tissue expander. A temporary balloon is placed under the skin and gradually inflated over several weeks. Once the desired size is reached, the expander is replaced with a permanent implant. Pros and cons. Recovery is generally faster and does not involve donor sites elsewhere in the body. However, implants may need replacement every 10 years, and there are risks of rupture or capsular contracture, scar tissue hardening around the implant. Flap tissue. Reconstruction. This method uses the patient's own living tissue to create a new breast. The process. A surgeon moves a section of tissue along with its blood vessels from the belly, back, buttocks, or thigh to the chest, where it is reconnected to the blood supply. Pros and cons. Because it uses natural tissue, the result often feels more realistic. However, it is a more intensive surgery involving a second donor site on the body, and there is a rare risk of the tissue flap failing if blood flow is interrupted. Final details. Nipple and areola restoration. The final step in many reconstruction plans is recreating the nipple and areola. While surgeons can sometimes perform nipple-sparing mastectomies, many patients require reconstruction of these features. Today, while surgeons can use small tissue flaps to create a nipple, 3D tattooing is frequently used to create highly realistic, pigmented areolas. Recovery and healing expectations, recovery timelines, vary significantly depending on the chosen method. Feature implant reconstruction, flap reconstruction, hospital stay, usually overnight, typically ~4 days, return to work ~4 weeks -8 weeks, activity limits, no heavy lifting, and LT. Pounds for 1 month, no heavy lifting, and LT. Pounds for 4-6 weeks, full recovery ~3 months, complete adjustment up to 2 years, ~3 months, complete adjustment up to 2 years. Note: for both types, patients should avoid soaking in baths, pools, or oceans for at least 6 weeks to prevent infection. Understanding the risks. While surgical techniques have advanced, no surgery is without risk. Common complications include infection, bleeding, and wound healing issues. Specific risks include, for implants, rupture or the need for revision surgery. For flaps, potential blood clot formation or flap failure. General risk factors. Smoking, obesity, older age, and previous radiation therapy can increase the likelihood of complications. Making an informed decision. Choosing a reconstruction path is a deeply personal decision. To ensure the best outcome, medical experts recommend consulting a specialist. Meet with a plastic surgeon who specializes in the specific technique you are considering. Reviewing portfolios. Ask to see before and after photos of previous patients. Seeking support. Navigate the emotional weight of these decisions through support groups, patient navigators, or mental health professionals. The bottom line: breast reconstruction is a versatile tool for restoring physical symmetry and emotional well-being, but it requires careful planning and a thorough understanding of the surgical trade-offs.